Well, hello there, Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. All right, spinal decompression therapy. What on God's green earth is spinal decompression therapy? I'm glad you asked that question. What happens is there was a neurosurgeon, his name was Norman Shealy, and what happened was he was found himself operating on people several times because they didn't get the relief and they needed from the first, second, third, and finally we decided there's got to be a different way than just doing surgery alone. Listen, sometimes people need to have surgery to relieve the back pain. So what he came up with was a traction device, a medical-based traction device that reduces pressure by on the disc. Okay, discs are usually the ones that herniate or bulge or cause compression onto the spinal nerve, or even in some cases the spinal cord. So when that happens, there's as a chiropractor, I can make the situation better, but I can't really put the genie back in the bottle. And that's what spinal decompression really is, especially for back pain. It's also for neck pain too. But I mean, it goes by a bunch of different names. You have spinal decompression therapy, non-surgical spinal decompression. You have spinal disc decompression, lumbar decompression, intervertebral disc decompression, decompressive therapy, vertebral decompression, mechanical traction therapy. All talking about the same thing basically. The disc has left its normal confines, and when that happens, as I said earlier, the genie has left the bottle. When the genie leaves the bottle, sometimes people will take Advil, leave, which is typical. Ice, rest, topical ingredients, topical treatments like Voltaren or capsaicin, icy hot. There's a number of different ways that people deal with the pain. But can you really fully expect the pain to go away if the disc herniation remains there? Probably not. I mean, eventually. So some people do have to opt for surgery. In some cases, you have what's called a free floating fragment inside there, and that's not good. It's just plain old not good. Every certain movements will really send you into hellish pain. That may need to be resolved surgically. Now, as a chiropractor, we don't do surgery, and we don't do any medications. So the spinal decompression came along, gosh, over 20 some odd years ago. And, I want to brag because Core Health was one of the fifth places in the country to offer it. They actually flew Dr. Shealy out to for the grand poobah when it was announced because it was really a life change. I mean, I had a bad back, and that's what got my back better. So it's kind of, you know, I call it the hair club for men moment, but it is true. So what happens is you want to the machine gently tractions the joint, and what happens in that case is it creates negative pressure into the disc space, and that negative pressure allows the disc to kind of reabsorb in many cases. It's almost like you're slurping something up. Well, think of it as a great big slurp. Um, sucking it back in, and in many cases it really does work phenomenally because it'll also bring in some cerebrospinal fluid into that. A desiccated disc is a dried out disc, so you have a herniated disc, but when it's desiccated, it's like a sponge. There's just nothing to it anymore, so it gets a little crusty and hard. When a disc is supposed to be nice and smooth and cushiony, so by sucking the fluid into the disc space, you rehydrate the disc. Think about it this way: if you have a spot, you go away for a few days, you come home, a sponge on the side of your sink. Well, if it's dried out, you would expect it, right? You put a little bit of water and it pops right back up. Well, that's the idea behind spinal decompression. Another way to think of it visually is take a tube of toothpaste. Next time you brush your teeth, squeeze some toothpaste on. You take you move the toothbrush away. There's a little bit left in the tube, or the opening of the tube. And as soon as you take pressure off the tube, the rest of the remaining toothpaste goes back into its normal confines. That's exactly the concept behind spinal decompression. So when you have spinal decompression, it's phenomenal. It's phenomenal, basically, when you have it, because what I have found typically is you obviously have to address the muscle, you have to address the nerve, you have to address the bone, you have to address the disc. And that's the key here is the disc is really, as a chiropractor, I can affect the bones around the disc, but I'm not going to get the disc itself. I mean, at least I can't. I mean, So with spinal decompression, it gives us that one up and a more permanent resolution than just getting someone out of pain and having to do more and more chiropractic adjustments as opposed. So the idea is, can we decrease the amount of frequency on on the on the patient, and get them really great lasting results. And I think with spinal decompression you can do it. Now it's also good for neck pain. People get herniated bulging discs in the neck, radiculopathy, all those different conditions. Well, all of those things contribute, and all those things to someone's pain. Those things can be treated pretty successfully. The big thing too is it's not invasive. Non-invasive means there's a lot less side effects. So if you're looking for a more conservative way to treat, especially a chronic low back pain, chronic low back pain is miserable, as you would expect it to be. And what happens is, people's lives. I mean, you just keep taking a pill, and you know what? Listen, you got to take a pill, 4 or 5 Advil every day just to get out of bed. Well, the problem's not getting solved. I mean, you might get through the day, which is fine, but you're not getting that problem solved. And that's where chiropractic comes in. Get the underlying structure shored up, get yourself feeling better, decompress the disc, then exercise, of course. Let me not forget the exercise, because if you don't do your exercise, it's going to probably come right back. All right, well, I'm Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. And you know what? We've been doing spinal decompression for a long time. And it's one of these, it's in your toolbox, and it's a great, great thing. I mean, I mean, just about every back case coming in here is going to get spinal decompression because it just is that much better, and it does cut down the number of treatments. If you have any questions, you can reach me 203-656-3636, 203-656-3636. Core Health is located at 551 Post Road in Darien. Same building as Quest Diagnostics. If you have any questions, if you'd like to try it out, give us a call. All right, you got my number, and hopefully you learned a little bit about spinal decompression. It is a great treatment. Thank you.